Certainly, some of the drugs that are, very interesting are some of the non-steroidal anti-inflammatory drugs. Some of those suggest during epidemiological studies that if you are on those for a long time, your risk may be lowered, but those are not causal associations. Those look to be basically implied associations. I think the clinical trials that were run, some of them are positive, some of them are negative. And so it's important to figure out if the timing of those are critical. So the trials, I think, need to be done in a population of subjects where you really know that you're starting the intervention at the right time. And if you think about it, if inflammation starts early, which we think may start even decades before the motor symptoms, based on the preclinical models, then we may need to start dosing or intervening way before you get your clinical diagnosis in a neurologist's office. And so it's possible that some of those anti-inflammatory non-steroidal clinical trials may need to start earlier. So some of those drugs are of interest and some may be repurposed. There are other drugs that have been tried in the diabetes field, Exenatide, PPARɣ, agonists, and things like that are basically yielding some early promising results. A few were a little disappointing. Again, I think the population of patients that they're being tried in may be a little bit too late and with too much advanced disease. So that's kind of going to be the challenge, I think, for the field, to identify the right cohort of patients to try these drugs so that you're not starting too late or that you're not using a population that's too heterogeneous and too mixed. Right? You need to have a population that really has inflammation so you can test that. There are others like some of the cannabinoid space that seems to be potentially anti-inflammatory so that you can see if some of the active ingredients that are part of, say, the marijuana plant may be anti-inflammatory and immunomodulatory. Those are being tested. There's immunotherapy that is aimed at targeting synuclein, so synuclein aggregation. So there's some vaccination trials going on that are really interesting. There's a few others, again, that are being used in the autoimmune space to target T cells and try to understand if there's T cells that are seeing synuclein that are autoreactive, similar to the ones that you see in things like rheumatoid arthritis and MS, multiple sclerosis. So I think we're learning a lot from the autoimmune disorders space, and hopefully some of those drugs will be able to be repurposed or redirected towards Parkinson's.